Hi, I am Angelica, I'm a student nurse, and today I will demonstrate how to prepare and administer an IV medication via Piggyback. So first I'm going to do hand hygiene. Then we'll compare the medication administration record against the physician's order to make sure that they have the same exact information. We're also going to grab the medication from the pixies and compare it with the mark. Emma Wrightson is the patient, 1, 2, 3, 4, 5, 6, 7, 8, 9, is the identification number, 30 years old, no known drug allergies. Right medication is Lasix, it's also called furosemide, 40 milligrams the order dose. I have here 10 milligrams per ml. And right route is IV, and right time is now at 12 to be given once daily. Now I'm going to be looking at the branded drug monograph to see how the medication needs to be prepared. I have here furosemide. It's a diuretic. It's used for anti-hypertensive patients. It can be administered by student nurse. Since this medication is already in a liquid form, we won't need to reconstitute it. We'll just dilute it. So since we're using an IV intermittent, this medication needs to be diluted in 25 to 100 ml of normal saline and administered up to 4 milligrams per minute. I am using 25 ml of normal saline because the patient is already in a hypertensive situation, and we don't want to be giving more fluids to the patient. And I'm choosing 60 minutes or 1 hour to infuse the medication because this is the first time the medication is going to be infused to the patient. So if there's any allergic reactions, we want to have enough time to intervene and stop the medication right away. Okay, and check out compatibility. This medication is compatible with normal saline. This is the one that I'm going to be using for dilution. And any potential hazards, any side effects will be nausea and vomiting. So now that we know how to prepare the medication, we can gather our supplies. I have here the tubing. Make sure that both ends have caps and doesn't have any tear that can compromise the system and also increase the risk of infection. I also have here the normal saline. It's not expired yet and it's good. Also, I would like to mention that when I check the label, I also check the expiration date to make sure that it is safe to give to the patient. Okay, we can start preparing our medication. Swab the top for 30 seconds, then spray for 15 seconds.
And that'll give us a final volume of 10 milliliters and final concentration of 6 milligrams per milliliter. Just some other info about this drug. It may cause pruritus, diarrhea, or anaphylaxis. So we're going to want to
I also would like to show you the calculation that I got. So this is the calculation. The dose that we need to draw from the vial is 4 milliliters and the infusion time will be 29 milliliters per hour. So I need to draw 4 mils of air here.
and I'm going to make sure sterility as and I'm going to withdraw 9.5.
Notice anything unusual?
To make sure that the air pressure is normalized.
Hey guys, you have 15 minutes left. I don't think I've written this now.
Okay, so there's my 9.5. Still have water. And I'm going to
And we have to get rid of the air bubbles.
And I'm going to mix my drug like this because I want to make sure that I'm not okay, so now that I have this, my final concentration is 100 milligrams per milliliter. I know that I'm going to need to withdraw 6.5 from that 650 milligram dose, and I'm going to calculation. Okay. So withdraw 6.5.
So I have here 4 mils of the order dose. I also did my label beforehand. This is the label for the IV medication and this is the label for the IV tubing. In the IV tubing, in the label for the IV tubing, it has my signature, the time and the date. I'm gonna do the second check before diluting the medication because we want to make sure that we have the correct dose. So the second check, I have Lasix, furosemide, that's the right medication, 40 milligrams to order I have, which is equal to 4 milliliters here. Also, the right route is IV and the right time is now to be given once daily. Okay. We can take this medication now.
Okay, so now that I've done that, I'm going to perform my second check. So I have here
Clean the port for 30 seconds, then right for 15 seconds.
which is equal to 6.5, and we have that. And to give IV, and this is every 8 hours, and her last test was 8 hours ago, so I'm ready to give it. This is for a patient at the pregnancy. So now that I've done that,
And discard this to the sharps container.
where's my seer? And then
Mix this to dissolve the medication.
one should be given 10 milliliters and 10 milliliters syringe.
So now that we have everything prepared, we can come to the patient's bedside. As we enter the room, I will do a quick safety check and I will do a hand sanitize. So bed is at the lowest level possible, sidewalls are up, patients not in respiratory distress. Call bells within reach, and the primary infusion is running at the right rate. Hi, Miss Emma Wrightson. My name is Angelica. I'm a student nurse, and now is the time for your IV medication. Can you tell me your name, your date of birth, or your age, how many years old? So we have two identifiers there. So we verified that we have the right patient. I would also like to check the IV insertion site for any complications such as edema, swelling, or redness. That's good. Okay. So the medication I'm giving you today is furosemide. It is for your hypertension to lower your blood pressure. You might experience some nausea and vomiting. And if you experience any of those, please use the call bell. We will also do some assessments before giving the medication because this antihypertensive medication, it can lower the blood pressure of the patient. So we'll check the patient's blood pressure. Okay, and I'm gonna do my last check. Am I right, sir? Am I right, sir? We've confirmed that we have the right patient. So now the right medication is Lasix. Right here, the label, Lasix. 40 milligrams the right dose. 40 milligrams. IV is the right route, and the right time is now to be given once daily. The patient also has the right to refuse, but we've already explained the medication to the patient, giving the right reason, and we're also going to document this medication after we've administered it, so that will be right documentation as well. We will also reassess the patient's response to the medication after like 10 minutes. Okay, so now that I've done that, I can... How many more minutes?
6 minutes.
Keep this sterile.
The drug name, the dose, how many milliliters, how I'm administering it, the final concentration, which is 65 milligrams per milliliter, the date and time, and my sentence. So now that I have that, I'm going to collect my supplies.
Is that there?
So I'm going to oxygen swab, drug makeup, I'm going to need medications, I'm going to need bar, 3 milliliters of syringe.
Make sure this is clamped.
Okay. As I enter the room, I'm going to do hand hygiene and also safety checks. Make sure her tubes and lines, everything.
I'm going to use the port that is above the pump because we want the medication to be infused and regulated by the pump. I'll be using this
We're
port.
administering your drugs, cefazolin, and this is for
Swab it for 30 seconds, then right for 15 seconds.
you may experience with this or nausea, vomiting, diarrhea, cramping, or irritation at the site. So please let me know if any of those. So as I'm here, I'm just going to inspect your eye bedside and make sure that everything is looking good and there's no sign of infiltration. And I'm going to perform. So here I have.
I'm gonna clamp this slowly to do back priming because we want to get rid of the air bubbles.
Any allergies? Okay, so now I have my cefazolin, 650 milligrams, which is now diluted in 5 milliliters. This is to be given IV. It's an IV medication every 8 hours for the last 18 hours.
That is good.
I'm ready to give it via CBAC.
Close this bit.
So first what I'm going to do is from the line.
And then we can set up our rate.
Initial date
So, for the rate we have,
it can be changed within an appropriate time.
for rate we have secondary. Administering the rate will be 29 mils per hour.
And I'm going to prime my line. This is because we don't want any air bubbles in our patient.
Okay, so for the rate we want to infuse 29 mils per hour. Okay, and the volume that we have is, here is 29 mils.
Just going to prime this until it's stable.
And then we want to unclamp this.
Labels just falling. I just want to make sure that it's
There you go. So, just gonna put the label right here. Here.
and I'm going to push it down to where the syringe is, and it was supposed to be a normal rate for 26 minutes, and so I see that
Let's just say this one sticks, so I'll just put the label here.
And I would also just ensure that my
And label of the IV tubing as well.
everything's good for that.
We want to make sure that there's 3 drips in the chamber to make sure that the medication is infusing, right? And we will check the insertion site. There's no complications, good. So I'm gonna leave now, Mrs. Wrightson. If you experience any nausea or vomiting, please use the call bell. And I will also document and sign the mark.